Welcome to a new semester at Purchase College. As we begin this semester, we are faced with the challenge of a global pandemic. To meet this challenge, the college has been working hard on a program to ensure the health and safety of students, faculty, and staff. Essential elements of our program are training and awareness. This presentation stresses precautionary measures to take to prevent the spread of the coronavirus. The coronavirus responsible for the current pandemic is highly contagious, due in part to it not being around long enough for people to develop immunity. An awareness of potential exposures, the hazards of exposure, and controls in place is essential to minimize or prevent exposure and the possibility of becoming infected. Because there is neither a vaccine to prevent infection nor a treatment for COVID-19, it is essential that everyone understands and practices everyday precautions, which include social distancing, frequent hand washing, and covering your mouth and nose with a mask or face covering when around others. A wide range of symptoms that are associated with COVID-19 have been reported, from mild to severe illness and even death. Spread of the virus is thought to occur mainly when an infected person coughs, sneezes, or talks, and respiratory droplets land in the mouths or noses or are inhaled into the lungs of people nearby. The virus can be spread by people who do not have symptoms and do not know that they are infected. That's why it's important for everyone to practice social distancing, which means staying at least 6 feet away from other people, and wearing masks in public settings. While COVID-19 is mainly spread by inhaling tiny droplets, large droplets can also land on surfaces. A healthy person can then unknowingly touch those surfaces and by touching their face can transport the virus to the face where it can enter your body through your eyes, mouth, or nose. This stresses the importance of washing hands frequently and not touching your face. Preventing the spread of COVID-19 begins with maintaining distance between yourself and others. 6 feet or more is recommended. Crowded indoor areas or events are known to be high risk for the spread if the ventilation is poor. Customary greetings such as handshaking, high-fiving, or hugs must be avoided at all times. Although an important and often overlooked practice to prevent the spread of germs, hand washing is now more important than ever. Frequently touched surfaces are around us at all times. Hand washing needs to become second nature. Soap and water provide an easy and effective way to remove viruses, bacteria, and other contaminants from your skin. When washing your hands, always take plenty of time and be as thorough as possible. Alcohol-based hand sanitizers are an effective substitute when soap and water are not readily available. Always read the product label to ensure the main or active ingredient is either ethyl alcohol, which may be listed as ethanol, or isopropyl alcohol, which may be listed as isopropanol. If methyl alcohol or methanol is listed, do not use the product. If unsure, do not use the product. An awareness of activities that can spread the coronavirus is essential. Do not take for granted coughing, sneezing, and touching your face, eyes, and mouth, which can expose you to the virus. Our daily routines place us in repeated contact with frequently touched surfaces. Be mindful of what you may be touching and take steps to protect yourself. Shared items pose a risk of spreading infection. If sharing items absolutely cannot be avoided, then they must be disinfected between users. Cleaning and disinfecting of frequently touched surfaces is also critical. To put it mildly, cell phones are just plain gross. Studies have found a host of viruses, bacteria, and pathogens on cell phones, indicating that they may play a role in the spread of infectious agents. If you are feeling sick, stay in your room and contact Student Health Services immediately to discuss treatment steps to be taken. Appropriate use of cloth face coverings or disposable masks is critical in minimizing risks to others. COVID-19 can be spread to others even by people who do not have any symptoms. Use of a mask or cloth face covering is not a substitute for physical distancing. Both must be done as much as possible. Masks must be worn in common areas and when in the presence of others, including but not limited to meeting rooms, classrooms, hallways, reception areas, etc. Having your mask with you at all times will ensure that you can put it on when needed. For face coverings to be effective, they must be in good condition and must fit properly. Both your nose and mouth must be covered at all times. Never share masks with one another, and always be sure you can breathe easily while wearing the mask. Putting on your face covering begins with washing your hands. Next, check the mask for defects. If none are found, it is okay to proceed. Position the mask against your face, and if the mask has a metal strip at the top, position it against the bridge of your nose. Mold the strip to the shape of your nose by pinching and pressing it down with your fingers. Place loops over ears. Position the bottom of the mask over your mouth and chin and pull the top over your nose. Once in position, don't touch the mask. If you will be wearing prescription or safety glasses, the face covering should be fitted first, then put on the eyewear. Although removing a mask may seem like a simple exercise, care must be taken to prevent exposure. Handle the mask only by the ear loops, pull it over your head and away from your face. Do not touch the mask. Discard disposable masks in a waste container and wash hands thoroughly. Use a hand sanitizer if soap and water are not available. Cloth face coverings should be laundered at the end of the day. In summary, the best way to prevent infection is to take everyday precautions which include social distancing, washing your hands often with soap and water, disinfecting frequently touched surfaces, and covering your mouth and nose with a mask when around others. Information regarding the coronavirus is readily available and changes frequently. Always consult reliable sources. And finally, when social distancing is difficult to maintain, wearing masks lowers the risk of spread to others. Please wear a mask. Stay healthy, stay safe. Thank you.